Hello, everybody. My name is Grace Nelson, and today I'm going to be talking to you about my undergraduate thesis research that I conducted with Dr. Kyle Rich. This was looking at community context and therapeutic recreation programming and how these experiences and processes can be implicated in rural long-term care. And the research was using a socio-ecological examination. Kyle and I found a lot of important insights from this research, so I'm really looking forward to sharing those with you today. So before I move into our findings, I just wanted to quickly cover some definitions that you might hear coming up throughout the presentation. So first, for the purpose of this research, rural was defined as the population living in towns and municipalities outside the commuting zone of larger urban centers, so outside the commuting zone of centers with a population of 10,000 or more. And then health promoting lifestyle behaviors or HPL behaviors is a term you might hear me use a couple of times throughout. And this is activities that both maintain and promote seniors' functional abilities. And this might be in regard to physical activity and also maintaining emotionally supportive relationships, so social activities or social engagement. And this was a very important term throughout the research because we were really looking at how these experiences of physical activity and social engagement were delivered to residents. And then, if you're not familiar with therapeutic recreation or the process of it, it is a holistic process that utilizes recreation interventions to maintain or improve quality of life and overall health. And it really focuses on the level of functioning in physical, emotional, and/or social domains. So before getting into our research process and some of our findings, I wanted to briefly touch on what is already known and what was already out there in the literature. So there were discussions about rural older adults having very strong community values, and there was a lot of emphasis placed on productivity. Also, that rural Canada has higher amounts of poverty in older rural populations. So with this history of a strong work ethic and traditional values being very important to rural older adults in some of the literature, it's interesting to think how this might impact HPL behaviors and how older adults may view or practice physical activity or engage in social opportunities. So older adults still recognize the value of physical activity, but maybe just in different ways than your traditional understanding of what physical or social engagement might look like. So, for example, outdoor activities might be more important to certain older adults in rural areas based off of their geographical location. And there was also a discussion about how older adults experience lower levels of social support in some instances because of factors in rural areas such as socioeconomic status, geographical or social isolation, and outmigration of youth. So having all of these different considerations and what HPL behaviors might look like in general for older adults might look different when you're looking in a rural context, given the different community factors, the social structures, and understandings of what HPL behaviors are in these settings. I also wanted to touch on long-term care in Ontario and therapeutic recreation practice when considering working with older adults. So long-term care is funded both publicly and privately within Canada, and each province and territory is responsible for their own organization, delivery, and monitoring of services. But these choices can be really strongly impacted by the social and health policies of where the facility is located. Which is why it's important to think outside of just urban centers and also how the different social and health policies of a rural center might affect long-term care practices and delivery. So TR can provide meaningful living practices to the older adult population. And with that definition we were talking about before of TR, it can consider this practice can consider different ways to provide meaningful HPL behaviors through recreation services for older adults. After exploring the literature that's already out there on rural older adults and community context, the purpose of this research then became to understand how rural communities create unique, so not necessarily bad, and that was what some of the literature might have been framing this as, that there's a lot of challenges and deficits of living in a rural community. So instead, how rural communities create unique environments for physical and social HPL behaviors. in long-term care and how this might be implicated through structural, political, and social aspects. So kind of those different levels that might be impacting long-term care. So the purpose was to first examine experiences of delivering TR programming in rural long-term care and understand what TR programming looks like in rural settings and how different interdisciplinary groups might affect this process. And second, to explore how the community context then influences TR practice in rural long-term care. The theoretical approach that was used for this research was the Socio-Ecological Model. And this was super helpful to see the different layers and the different ways that health promotive environments can be affected by the individual, but also the team that they're working with, also the organization and the policy rules, the community. So it was very helpful in the end to organize my findings and kind of use this lens that health is not just the individual, but a multi-layered experience with many different environmental conditions that can affect it. So here we can take a closer look at the model, and I've put in some examples from our research in here. At the bottom, we have interpersonal factors, and then you can see how you move up the diagram to interpersonal processes, institutional factors, community factors, and public policy. So we can see how something, for example, at the bottom, maybe how motivated staff are to provide care for the residents, could be impacted at something near the top. Like in community factors, we have lack of funding, tight-knit community. So this model really helped me to visualize and understand how everything's interconnected, and none of these levels work in isolation from one another. Moving forward to the research process, this research used a single qualitative case study of a center called Northwood, which is a pseudonym we used. This is a long-term care facility located in rural northern Ontario. The population of the municipality is 3,455 residents, and it's located a short drive from a city of 50,000. So that fits our definition of rural that we used for this study. And the center provides 24-hour nursing and personal care and is a municipal home within the community. 9 individuals were purposefully sampled for this study. So that included recreation therapists, directors of recreation, relevant individuals who work in recreation for the municipality, members of administration and management, a volunteer, and a physio representative, so that we could really get that interdisciplinary understanding of how the team works and how therapeutic recreation works within a long-term care setting to deliver HBL behaviors. The data was analyzed using a thematic analysis so that we could get some patterns and themes that were coming up from the data and group them together. So now for the exciting part about our findings. So there were 2 higher order themes that came from this research. The first was the influence of healthcare policy and practice on TR programming. So this had themes of the team approach, factors constraining TR programming, and HBL behaviors. And then the second higher order theme was recognizing context-specific challenges and opportunities in rural areas. So sub-themes that came of this were tight-knit community, value volunteers, and rural-specific considerations. So first we'll dive into the higher order theme of the influence of healthcare policy and practice on TR programming. This higher order theme had 2 important sub-themes, the first one being a team approach to care. And there was a lot of positives talked about in a team approach to care. For example, here you can see an administration member talking about how there needs to be sort of that communication at every level, which is happening every day. The dietary staff, the nursing staff, the activity staff. So within this theme, there was a lot of discussion about how physio, nursing, TR, administration, everyone came together to coordinate schedules, communicate, and work together to deliver these different healthcare policies and practices. So without these all working together, the TR programming wouldn't have been as effective. And while it was great to hear those experiences of the team approach to care and how that helped for successful delivery, there were also a lot of factors constraining TR programming and HBL behaviors that were discussed. So you can see in this quote here, the director of recreation is talking about being unionized and having the union, the Ministry of Labor, and public health, and all these different things you're trying to balance to bring the best quality of life for residents. So this came up a lot, this idea of ratio challenges, time constraints, navigating policies, maybe even the residents feeling bored with the programs that are being provided through TR. All of these different things can really affect how TR is delivered. And while this might be a problem that is discussed in a lot of different long-term care settings, it's important to think about how these larger scale challenges would be intensified in a rural setting, and that's what the next theme got to take a deeper look at, the more context specific challenges. So here we're moving away from those bigger ideas of what affects TR programming and diving into what it is actually like to deliver programming in rural settings. So one of the first sub-themes here was a tight-knit community, and this came up with almost every single participant in the study. And it was discussed that you have small town people who have lived here their whole life that are now caring for the folks that lived here. So people were born and raised in the community. There was a lot of community awareness about the events that were going on. There was staff from the community. There was longevity within the staff because these were people from the community. And having such a tight-knit community led to a lot of volunteers being included in the long-term care practices. So someone said here, we've got, I'm guessing, 150 volunteers, from drivers to, just volunteers that come in and spend time with people. People are giving up their time to spend time with our residents, and that's really important. So we can see this tight-knit community was really a strength and an opportunity in a lot of ways. For the community to deliver a lot of HPL behaviors to the residents. But then there were also some rural specific considerations that needed to be taken into account when you're considering community context, and maybe some of the challenges that go on in a rural area. So I'm going to read this whole quote because this is something that really resonated with me. They pointed out that the rural grant has been over whatever, and there was no more money, and the rest of the money was going to public transit. So my comment was, there are no buses where I live. And they said, well, the other money goes to subways and LRTs. Well, there's no goddamn subway where I live. So there's a huge amount of money that goes to, it always will, and I understand the greatest need for the greatest good, but I think the rural areas are being left in the backwater. We are not getting the funding we need. And we can see here that while there's a lot of strengths and we have a very tight-knit community conversation going on within this research, there are still things that are being pushed to the side in rural areas and not being discussed in a rural context. Things are kind of glazed over with this urban view of how things should be understood. So after analyzing these findings, there were some really important insights to consider. Something that really came up a lot was the importance of different disciplines and volunteers collaborating in rural areas when addressing both large-scale and context-specific challenges. And while a lot of these challenges I'm talking about you might see across the board in long-term care centers, these things can really be exacerbated when in a rural setting, when we're already dealing with challenges and issues such as staffing, transportation, poverty. The findings also brought up really important application pieces for TR professionals or anybody working in long-term care settings, specifically in rural areas. So first and foremost, the way healthcare decisions are being made, we need to change this a little bit, how we're viewing problems. And this idea of a rural and context-specific lens can be a lot more effective when making healthcare decisions for rural areas than trying to just generalize everything to an urban-centered view, because clearly from these findings, there's different needs within rural community contexts. Also, for TR and all recreation professionals, there's a lot of conversation about how to think about the individual and think about how to make the individual's experience different. But this research and using this theoretical approach allows us to consider how broader social systems are impacting lived experiences of both residents and staff. So recognizing that people have these diverse backgrounds based off of where they might be living, where they might have grown up, that can really impact the way they're experiencing HPL behaviors in TR programming. So this is something to take into consideration as well. I'm looking forward to discussing these findings more in depth with you in the live session, but these were just some big takeaway pieces from the research. Thank you all for listening to this presentation. Here are the references I used throughout for the information for this presentation, and I'm looking forward to discussing with all of you in the live session.